Hey everyone, Dr. William Lee here, and today I'm sharing the most unbelievable case I've ever witnessed in my entire medical career. Before we start, make sure you hit that subscribe button because what I'm about to tell you will absolutely blow your mind. So picture this, it's a regular Tuesday evening at the hospital. I'm finishing up my shift, getting ready to head home, when suddenly the ER calls me. They say, Doctor, we need you urgently. We have a 23-year-old woman complaining of severe abdominal pain. Now, abdominal pain is common, right? Could be appendicitis, could be food poisoning, could be a million things. But what happened next? Nobody could have predicted. I walk into the emergency room and I see this young woman, let's call her Sarah, lying on the bed, clutching her stomach in absolute agony. Her face is pale, she's sweating profusely, and she's crying from the pain. I immediately start my examination. I ask her the standard questions. When did the pain start? What does it feel like? Have you eaten anything unusual? She tells me the pain started about 6 hours ago. It's getting worse and it feels like intense, cramping. Here's where it gets interesting. I notice her abdomen is slightly distended. As a trained OB-GYN, my medical instincts kick in. I ask her, Sarah, is there any chance you could be pregnant? And you know what she says? She looks at me like I've lost my mind. She says, Doctor, that's impossible. I had my period last month. I'm not pregnant. I think it might be something I ate, but here's the thing about being a doctor for over 10 years. You learn to trust your gut feeling. Something wasn't adding up. The type of pain she described, the way her abdomen looked, the cramping pattern, all of these were screaming one thing to me. So I said, Sarah, I know this might seem unnecessary, but I'd like to do an ultrasound just to rule everything out. It's a standard procedure for abdominal pain in women of childbearing age. She reluctantly agrees. We wheel her into the ultrasound room. I apply the gel on her abdomen, place the transducer, and look at the screen. What I saw next made my jaw literally drop to the floor. On that screen, as clear as day, I could see a fully developed baby. Not just any baby, a full-term baby. I'm talking about a baby that's ready to be born, probably around 38 to 39 weeks. I freeze for a second. My nurse looks at the screen, looks at me, and her eyes go wide. Sarah is lying there, completely unaware of what we're seeing. I take a deep breath and I say, Sarah, I need you to stay calm. You're not having a stomach ache. You're in labor. You're about to have a baby. The look on her face, I will never forget it as long as I live. She sits up so fast, pointing at the screen and screams, What? That's impossible. How can I be pregnant? I've had my periods. My stomach isn't even that big. I was at the gym last week. How is there a baby inside me? This, my friends, is what we call a cryptic pregnancy, also known as a stealth pregnancy, and it's way more common than you think. Studies show that 1 in every 400 to 500 pregnancies is cryptic. That means the woman has absolutely no idea she's pregnant until very late in the pregnancy, or in cases like Sarah's, until she's literally in labor. Now you're probably thinking, Doctor, how is that even possible? Isn't pregnancy obvious? Well, let me break down the science for you. In cryptic pregnancies, women continue to have what they think are periods. But these aren't real periods. They're actually breakthrough bleeding or spotting that can happen during pregnancy. The bleeding is light enough that women mistake it for a normal menstrual cycle. Secondly, not all women show obvious baby bumps. If the baby is positioned towards the back of the uterus, if the woman has a longer torso, if she's overweight, or if she has strong abdominal muscles, the pregnancy might not be visible from the outside. Sarah was a fitness instructor. She had incredibly strong core muscles that literally held everything in. Third, pregnancy symptoms like nausea, fatigue, and breast tenderness. Sarah experienced all of these but attributed them to stress from work, maybe a stomach bug or hormonal changes. She never connected the dots because she had no reason to suspect pregnancy. And here's the craziest part. Some women with cryptic pregnancies don't feel the baby moving, or if they do feel something, they think it's gas, digestive issues, or muscle spasms. The human brain is amazing at rationalizing things that don't fit our expectations. So back to Sarah. Within 2 hours of discovering she was pregnant, she gave birth to a healthy 7-pound baby girl. Can you imagine? You wake up thinking you have food poisoning, and you go to sleep as a mother. The emotional whiplash must have been absolutely incredible. But this story raises so many important questions. How do you prepare for motherhood when you have zero time to prepare? How do you process becoming a parent in just a few hours? And most importantly, how do we as doctors make sure women are aware that cryptic pregnancy is real? That's exactly what I'm going to explain in the next part of this video. Stay tuned because what I'm about to share could literally save lives. Welcome back. If you're just joining us, make sure you go back and watch the first part where I shared Sarah's incredible story. Now, let's dive deep into the medical science behind cryptic pregnancies, because understanding this could help you or someone you know. First, let me address the elephant in the room. The number one question I get asked is, Doctor, how can a woman not know she's pregnant for 9 months? Don't pregnancy tests work? Great question. And the answer is more complex than you might think. Pregnancy tests detect a hormone called HCG, or human chorionic gonadotropin. This hormone is produced by the placenta after the embryo implants in the uterus. In a typical pregnancy, HCG levels double every 2 to 3 days in early pregnancy. Home pregnancy tests can detect HCG levels as low as 25 milli-international units per milliliter. But here's the catch with cryptic pregnancies. In some cases, HCG levels don't rise as predictably. Some women have what we call the hook effect, where extremely high levels of HCG actually cause false negative results on home pregnancy tests. Yes, you heard that right. Too much pregnancy hormone can make the test say you're not pregnant. This happens because the excess HCG overwhelms the test, preventing the antibodies from binding properly. Additionally, some women take the test at the wrong time, use it incorrectly, or take it when their HCG levels haven't risen enough to be detected yet. If a woman is convinced she can't be pregnant because she's having periods, she might not even think to take a pregnancy test in the first place. Now, let's talk about the menstrual bleeding during pregnancy. This is probably the most confusing aspect for women experiencing cryptic pregnancy. In medical terms, we call this decidual bleeding. The decidua is the modified lining of the uterus during pregnancy. Sometimes this lining sheds slightly, causing bleeding that mimics a period. This bleeding can be regular, occurring monthly, which tricks the brain into thinking everything is normal. It's usually lighter than a normal per IOD, but not always. Some women have always had light periods, so they don't find it unusual. Others might have irregular periods due to conditions like polycystic ovary syndrome or PCOS. So irregular bleeding doesn't raise red flags for them. Another crucial factor is body weight and body composition. I want to be sensitive here because this isn't about body shaming at all. It's pure anatomy and physiology. Women with higher body mass index, or BMI, might not notice the physical changes of pregnancy as obviously. The growing uterus and baby can be masked by existing abdominal tissue. Additionally, weight fluctuation that many women experience normally can hide the gradual weight gain of pregnancy. Similarly, women who are very athletic with strong abdominal muscles, like Sarah from our story, can have pregnancies that don't show in the typical way. Those six-pack abs and oblique muscles can literally hold the uterus in a position that's less visible from the outside. I've seen pregnant patients who are professional athletes who barely showed until their third trimester. Let's discuss fetal movement, or what pregnant women call quickening. Typically, women start feeling their baby move around 18 to 20 weeks of pregnancy. These movements start as little flutters and gradually become stronger kicks and punches. But in cryptic pregnancies, women either don't feel these movements or misinterpret them completely. Why? Several reasons. If the placenta is positioned T, the front of the uterus, what we call an anterior placenta, it acts like a cushion that dampens the feeling of movement. The woman might feel something, but it's so subtle she thinks it's intestinal gas or digestive gurgling. If it's her first pregnancy, she has no reference point for what baby movement should feel like, making it even easier to dismiss. Some women also report that they attributed the movements to muscle twitches, especially if they're physically active. Your muscles twitch and spasm regularly, particularly after exercise. So feeling something move in your abdomen? not necessarily alarming if you have no reason to suspect pregnancy. Now, let's talk about the psychological aspect because this is fascinating. The human brain has an incredible ability for cognitive dissonance. This means we can hold two conflicting beliefs simultaneously and rationalize away the contradiction. If a woman firmly believes she cannot be pregnant, maybe because she's using birth control, maybe because she's been told she's infertile, maybe because she's in menopause, her brain will literally explain away every single symptom. Weight gain must be stress eating. Nausea, probably that stomach bug going around. Fatigue, working too hard. Missed period, stress, or hormonal imbalance. The brain is protecting itself from information that doesn't fit the established narrative. This isn't stupidity or denial in a negative sense, it's actually a normal psychological defense mechanism. There are also certain medical conditions that can mask pregnancy. Women with PCOS often have irregular periods anyway, so missing periods isn't unusual for them. Women going through perimenopause expect irregular cycles and strange symptoms. Women with thyroid disorders, diabetes, or other hormonal imbalances might attribute pregnancy symptoms to their existing conditions. Birth control is another factor. Women using contraception, especially long-acting methods like IUDs or implants, feel protected against pregnancy. The failure rate is low, but not zero. Even though these methods are over 99% effective, that still means some women will get pregnant while using them. And because they trust their birth control, they don't suspect pregnancy. So what are the warning signs that you or someone you know should watch for? I'm going to reveal the critical symptoms that should never be ignored, and I'll explain when you absolutely must see a doctor. Keep watching because this information could be life-changing. Welcome back to the most important part of this video. What I'm about to share with you could genuinely save a life, so please pay close attention and share this video with every woman you know. Let's start with the warning signs that should always prompt you to see a doctor, even if you're absolutely convinced you're not pregnant. These are the red flags that medical professionals look for, and knowing them can make all the difference. Warning sign number 1, persistent abdominal bloating that doesn't go away. Now, we all experience bloating from time to time, especially around our menstrual cycle or after eating certain foods. But if you have bloating that lasts for weeks, that keeps getting progressively worse, or that's accompanied by a hard, distended abdomen, you need to get checked out. This could be pregnancy, but it could also be ovarian cysts, fibroids, or other serious conditions that need medical attention. Warning sign number 2, changes in your menstrual pattern that persist for 3 or more cycles. Maybe your periods used to be regular, and now they're all over the place. Maybe they've become much lighter or much heavier. Maybe you're spotting between periods. Any significant change in your menstrual pattern that lasts more than 3 months deserves investigation. Don't just brush it off as stress or aging. Warning sign number 3, unexplained weight gain, especially in your midsection. I'm not talking about gaining 5 pounds during the holidays. I'm talking about gaining 15, 20, 30 pounds over several months without any clear reason. If your eating habits haven't changed, your exercise routine is the same, and you're still gaining significant weight, especially around your abdomen, see a doctor. Get your thyroid checked, get your hormones checked, and yes, consider a pregnancy test. Warning sign number 4, persistent nausea that isn't explained by any digestive condition. Morning sickness isn't always just in the morning, and it doesn't always mean vomiting. Some women just feel constantly nauseous, a little queasy all day long. If this goes on for weeks and you can't identify a cause, it's time to investigate. Food poisoning doesn't last for weeks. A stomach virus doesn't last for weeks. Persistent nausea needs explanation. Warning sign number 5, breast changes that last more than 1 menstrual cycle. Yes, breasts can be tender before your period, but if your breasts are consistently tender, if they've increased in size, if your areolas have darkened, or if you're seeing any discharge from your nipples, these could be signs of pregnancy or other hormonal changes that need evaluation. Warning sign number 6, feeling movement in your abdomen that's rhythmic, regular, or progressively getting stronger. I know we explained that women can mistake baby movement for gas or muscle twitches. But here's the thing. Gas doesn't have a pattern. Muscle twitches are random. If you're feeling regular movements, especially if they're getting stronger over time, if they happen more at certain times of day, or if you can sometimes see your abdomen move from the outside, you need to get checked immediately. Warning sign number 7, sudden severe abdominal pain, especially if accompanied by bleeding, dizziness, or shoulder pain. This one is critical because it could indicate an ectopic pregnancy, which is a life-threatening emergency. In an ectopic pregnancy, the embryo implant TS outside the uterus, usually in the fallopian tube. If this ruptures, it can cause severe internal bleeding. This is a medical emergency that requires immediate surgery. Now let me share more real cases I've encountered. I had a patient, let's call her Maria, who was 42 years old. She came to me because she hadn't had a period in 4 months. She assumed she was going through early menopause because she was at that age, and her mother had gone through early menopause too. She had hot flashes, mood swings, all the typical perimenopausal symptoms, except when I examined her, I found she was 5 months pregnant. The hot flashes were actually the increased body temperature that comes with pregnancy. The mood swings, pregnancy hormones, she had every reason to believe she was entering menopause, so pregnancy never crossed her mind. Another case, a college student, 19 years old, athletic, healthy. She came in for what she thought was really bad period cramps. She was doubled over in pain, couldn't walk straight. When I examined her, I could actually feel the baby's head. She was in active labor, fully dilated, about to deliver. She delivered a healthy baby boy 30 minutes after arriving at the hospital. She had been having regular periods, or so she thought, the entire pregnancy. She was on the pill. She played soccer throughout her pregnancy. She literally had no idea. Then there's the case of Jennifer, who was told by multiple doctors that she was infertile due to endometriosis. She had surgery for her endometriosis, was told pregnancy would be extremely difficult, if not impossible, without IVF. So when she started gaining weight and feeling tired, she thought her endometriosis was flaring up again. She came to see me for endometriosis treatment, and I discovered she was 7 months pregnant. Her mind had completely blocked out the possibility of pregnancy because she'd been told for years it couldn't happen naturally. These stories aren't rare exceptions. I've personally delivered over 20 cryptic pregnancy babies in my career. That's 20 women who had no idea they were pregnant until very late in pregnancy or until labor started. And I'm just one doctor in one hospital. The psychological impact of cryptic pregnancy is profound. Imagine going from not being pregnant to being a mother in a matter of hours. There's no time to prepare nursery, no baby shower, no time to mentally prepare for parenthood. In the final part of this video, I'm going to share how these mothers coped, what resources are available, and how society needs to better support women experiencing cryptic pregnancy. You don't want to miss this. Welcome to the final and perhaps most important part of this video. We've covered the shocking discovery, the medical science, and the warning signs. Now let's talk about the human side of cryptic pregnancy and what we all need to know to support women going through this experience. Let's go back to Sarah from the beginning of our story. After delivering her baby girl, Sarah went through what we call acute psychological adjustment. Within the span of 12 hours, her entire identity changed. She went from being a single, career-focused fitness instructor to being a mother. There was no 9-month preparation period, no time to research parenting books, no baby shower, no nursery, nothing. The first 48 hours after delivery were critical. Sarah experienced a whirlwind of emotions: shock, disbelief, fear, confusion, joy, anxiety, and overwhelming love, all at the same time. She kept asking me, "How did I not know? What kind of mother doesn't know she's pregnant? Does this mean I'll be a bad mother?" These questions broke my heart because the answer is absolutely not. Here's what I told Sarah, and what I want to tell every woman who experiences cryptic pregnancy. Not knowing you are pregnant says nothing about your intelligence, your maternal instincts, or your ability to be a good mother. Cryptic pregnancy is a medical phenomenon, not a personal failing. You are not alone, you are not broken, and you are not a bad person. The hospital's social work team immediately got involved. Sarah needed practical help fast. Where would the baby sleep? What about clothes, diapers, formula? She was planning to breastfeed, but she hadn't prepared mentally or physically. The lactation consultant worked with her around the clock, Local charities and organizations donated everything she needed to bring her baby home safely. But beyond the practical needs, Sarah needed emotional support. We connected her with a therapist who specializes in perinatal mental health. She also joined a support group for mothers who experienced cryptic pregnancy. Hearing other women's stories helped her realize she wasn't crazy, she wasn't alone, and her experience, while rare, was valid and real. One of the biggest challenges Sarah faced was dealing with judgment from others. When people found out she didn't know she was pregnant, some made insensitive comments. How could you not know? Didn't you feel the baby kick? Were you in denial? These questions, even when asked without malicious intent, were incredibly hurtful. They implied Sarah was somehow negligent or stupid, which couldn't be further from the truth. This is where society needs to do better. We need to educate people about cryptic pregnancy so that women who experience it aren't stigmatized or judged. We need to create better support systems. We need healthcare providers to be aware that cryptic pregnancy exists and to take women's symptoms seriously, even when pregnancy seems unlikely. From a medical standpoint, cryptic pregnancy also raises important questions about prenatal care. Sarah's baby was born healthy, but she had received zero prenatal care. No vitamins, no ultrasounds, no monitoring. She drank alcohol socially. She was taking ibuprofen for muscle soreness. She was doing intense exercise. Luckily, her baby was fine. But not all cryptic pregnancy babies are so fortunate. This is why awareness is so crucial. If we can educate women about the possibility of cryptic pregnancy, if we can encourage them to pay attention to their bodies and seek medical care for unexplained symptoms, we can potentially identify these pregnancies earlier. Early identification means prenatal care, which means healthier outcomes for both mother and baby. Let me share the follow-up to Sarah's story. 6 months after giving birth, I saw Sarah for a postpartum checkup. She walked into my office with her baby girl, and the transformation was incredible. She was confident, glowing, and clearly deeply in love with her daughter. She told me, "Doctor, the first few weeks were the hardest thing I've ever been through. I cried every day. I felt like I was drowning. But with therapy, with support, and with time, I adjusted. And now, I can't imagine my life without her. She's the best thing that ever happened to me, even if I didn't know she was happening." Sarah's story has a happy ending, but not all cryptic pregnancies do. Some women discover their pregnancy during labor, but aren't prepared for motherhood and may consider adoption. Some women are in abusive relationships, and the cryptic pregnancy complicates an already dangerous situation. Some women have medical complications during delivery because they haven't had prenatal care. These are real challenges that need real solutions. So what's my final message to you? First, listen to your body. If something feels off, don't ignore it. Don't let embarrassment or assumptions prevent you from seeking medical care. Second, if you're sexually active, understand that no birth control method is 100% effective. Third, know the warning signs I outlined in this video and take them seriously. If you are a healthcare provider watching this, please remember that cryptic pregnancy is real. Take your patients seriously when they present with unexplained symptoms. Don't dismiss their concerns. Run the tests, do the ultrasound. Better to rule out pregnancy than to miss it. And if you know someone who has experienced cryptic pregnancy, please be kind. Don't judge. Don't make insensitive comments. Offer support, understanding, and compassion. These women are going through something incredibly difficult, and they need our help, not our judgment. Thank you so much for watching this entire series. If this video helped you understand cryptic pregnancy better, please hit that like button, subscribe to my channel for more medical insights and real stories from the delivery room. Share this video with every woman in your life because this information could literally change someone's life. Drop a comment below telling me what you think. Have you or someone you know experienced cryptic pregnancy? What other medical topics would you like me to cover? I read every single comment and I love hearing from you. Until next time, take care of yourselves, listen to your bodies, and remember, your health is your wealth. I'll see you in the next video where I'll be discussing another fascinating medical topic that you won't want to miss. Stay healthy, stay informed, and I'll see you soon.